Is today on eNCA, 26 minutes after 5. Good to have you with you. Good to be with you on eNCA. I'm Gareth Edwards. Let's talk suicide, shall we? Rates are higher among men than women. In fact, a recent study has found that men are 5 times more likely to die by suicide. June is Men's Health Month, and the SA Society of Psychiatrists is urging men to speak up and ask for help. But that seems to be the problem, isn't it? Dr Ian Westmore, who is a member of the society, joining us. Hello to you, Dr Westmore. Good evening to you. Why do men find it so hard to ask for help when they're dealing with such serious issues?
Hi, Gareth. Good to be with you. Yeah, we think that it's a problem because men are not used to talking about their emotions, and that men generally don't go and see a doctor very easily for any health reason, much less so for emotional problems. And often the depression, which is the underlying cause in most cases of suicide, is masked in men because they don't come out and say, well, I'm feeling depressed. They might complain of other things, and they don't go and get the help early enough because depression is a treatable condition. So we think that it's often missed, and that's why we have this rate in men. Interestingly enough, women attempt suicide much more than men. But men, when they do attempt suicide, usually use more lethal methods and are more successful, and that's why we see the much higher rate in men.
Tell me if I'm slightly off track here, Doctor. Do we need to dispel the rumour that an attempted suicide that has failed is actually a cry for help, or is it an actual failed suicide?
Well, that's what's called a parasuicide attempt, and that's far more common in women, but it always needs to be taken seriously because it could be the last step before a completed suicide. And normally, people that are experiencing suicidal thoughts often feel completely overwhelmed by the situation that they're in at that moment. So it might be a cry for help, and one needs to listen because they're feeling overwhelmed. What they don't realize at that time is that that feeling is temporary. And obviously a completed suicide is a permanent solution to a temporary feeling, because feelings do change over time. But depression is where your mood, which is the underlying emotional state, is consistently down. And it needs to be down for at least 2 weeks, most days of the week, for one to be able to make the diagnosis of a clinical depression. So yes, one needs to take it seriously in all cases.
So how does a family member watching us this evening, Doctor, who suspects that a male, the man in their life, may have depression, but as we were discussing at the start, men don't talk about this. So how do we begin approaching this with a gender that doesn't want to talk about it, probably won't acknowledge it, and will probably kick back if you try and approach it?
Yeah, I think one needs to look for the telltale signs, and in men that can often present as behavioral problems. So when the behavior changes and men become more withdrawn on the one hand, and they don't engage as much socially as they used to, they don't talk as much as they used to, then one needs to suspect depression. Or otherwise, men might become much more irritable and have almost aggressive outbursts. Then one needs to start thinking that there might be a problem. And interestingly enough, what men often do is they self-medicate. So they self-medicate often with alcohol. And if a male member of the family starts drinking much more, that's a big warning sign that one needs to start looking for underlying depression or anxiety states. And what we see is that in completed suicide in males, alcohol use or substance use at the time was often the thing that just pushed them over the edge and gave them enough courage to be able to go ahead with a suicide attempt. So we need to remember that we live in very trying times at this time, and that there are a lot of contributory factors to men feeling that they are overwhelmed. You know, economic problems, social problems, COVID, and all the things that went with that are all contributing to the rate of depression in men.
And this is not to be flippant, Dr. Westmore, at all, but is this a case of male ego, or is it a social construct that we've all been taught that big boys don't cry and we need to be the head of the household?
Definitely a social construct, and I see this across all cultural groups that I treat, and I know all my colleagues do as well. We must remember that men are often taught from a young age to suppress their emotions and not to talk about their emotions, and to man up, as it were. And that's exactly the last thing that a male needs to do when they are in a state of depression, because they find it difficult and they need to talk about their difficulty. So there's a lot of stigma attached to that, and men are afraid of seeking help because they're scared that if they start saying that they don't feel well emotionally, that they'll be perceived as being weak or out of control or not dependable, that they won't be able to fulfill their role. So they rather act out in different ways which are paradoxically almost more acceptable, like being irritable or being aggressive. And we need to, that's why we're talking about it, we need to change that. Men don't have the emotional vocabulary often that women grow up with, and this is a bit of stereotyping, but need to be taught to give expression using words with their emotions, perhaps from a younger age.
And I suppose just before I start saying goodbye to you, Doctor, this is where we find ourselves in a rock and a hard place, isn't it? Men generally, as you say, won't talk about their problems. So that means they're not going to turn to a family member or a friend for help because they'll be seen as weak. So then the question must be, where do men go where they won't feel belittled, they won't feel as though they're being judged? Where do we get that help in the country?
Yeah. There are two places that I would recommend. The one is talking to your GP, but we know that often men don't go to their GP even for health problems. But if you do go to your GP and you feel confident talking to your GP should be able to point you in the direction that you should go and start treating the depression. Alternatively, you can contact the South African Depression and Anxiety Group, where there are counsellors available 24 hours a day that are trained and know how to answer your questions and also point you in the right direction. I can give you the number. It's 0800 121 314, or you can send an SMS to 32312, and someone can help you.
And I'm going to repeat that number just before we say goodbye, Doctor, as well. Just help me then, let's find some advice. So that's how men on their own, if they feel that they may have a problem, perhaps the drinking has gone up exponentially, they are able to see themselves internally there might be an issue with depression. That's where they can go there. Someone watching at home who might not know what to do with a loved one, a male in this case, that they suspect has depression. What is your recommendation to approach the problem? Because that's the sticking point, isn't it? Where do you start the conversation?
Yeah. I think perhaps, and I see this often, is perhaps to say, well, I heard an interview and someone said that the symptoms of depression are X, Y, and Z. And for instance, saying that if you have a down mood, and it's persistently so for most days of the week for at least a 2-week period, then that's a sign that you might have clinical depression, which is different to having our down days, which we all have from time to time. And the second most important symptom is if there's a change in being able to enjoy things that you normally used to enjoy. So you look forward to watching the rugby with your mates, for instance, and now you just couldn't be bothered anymore, then that is a warning sign. So pointing people to the warning signs is a way of opening up the discussion that there might be depression. And then also if you see that there are changes in people sleeping, people either battle to fall asleep, wake up during the night, or wake up very early, can't fall asleep again, or else there's a change in appetite, and weight, and also a decrease in sexual drive or libido. Those are all the accompanying symptoms together with the suicidal ideation. So talking about these signs and symptoms is sort of a gateway to helping someone.
And maybe I will leave this as my last question to you, Doctor. Forgive me, it's just I'd like to get as much information as possible. Are there certain age groups that are more prone in males where suicide is more prevalent? I ask the question because teenagers can be quite moody. Teenage boys can be a handful at the best of times. So how do we tell the difference?
Yeah. Depression can look a little different in teenagers. There we often see much more of an irritability than a down mood, and then all the other symptoms of depression as well, with the substance use and so on. And often then the withdrawal is a symptom of depression in teenagers because they like to be with their mates. And then there's a change that makes you think that they have depression. But interestingly enough, the highest risk group for suicide in males is actually elderly males. And that is often ignored. So if an elderly male starts showing signs of depression, don't just think, well, this is normal for grandfather to be quieter or to drink a little more or whatever the case may be. You really need to have a look at that, especially if there's a family history of suicide, if there's been a successful suicide in the family. For any age group of males, you need to have a higher index of suspicion and to take action sooner.
I really appreciate your time. I'm going to repeat the number back to our viewers, Doctor. Please jump in if I've got this wrong. I wrote it down as quickly as possible. 0800 121 314. That's the number I managed to write down. Is that correct?
That's right.
Okay,
Yeah,
I appreciate that.
right.
Doctor, joining us this evening, that number again, it's so important I repeat this, 0800 121 314. My thanks this evening on eNCA today, joining us, Dr. Ian Westmore, as we look and focus on June being Men's Health Month, looking at the mental health and depression of men in our country.